One of the most intimidating parts about thinking about a knee replacement is the fact that, listen, that operation hurts. And the recovery process, going through physical therapy, is quite uncomfortable as well. Now, pain management is pretty good, and the pain management around the time of surgery and pain management with medications has all come a long way. But there's been a recent fairly significant breakthrough that we've been doing about 2 years, and now we have enough experience in it that we can pass it along to our population at large, if you will, for people who have a knee replacement planned and would really rather lessen the intensity of the experience afterwards. If you look at a typical knee, around the knee there are 6 nerves that give sensation to the joint, 4 of which give the principal sensation of pain to the joint, and they lie here, 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 and right behind the quadriceps tendon, which of course goes into the patella here. Now we have a way of getting to these nerves as long as they're in the right spot, and testing and seeing if those nerves are in the right spot and see if they give the majority of sensation to the joint. That's called genicular nerve test blocking, because these are all subgroups of geniculate sensory nerves to the knee joint. Now that's called a geniculate nerve block, and we usually abbreviate that GNB. We would take you to the fluoroscopy suite, and under fluoroscopic control and local anesthesia, slip a small needle into each of these spots where we expect the nerve to live. Inject a very small amount of local anesthesia into each of these areas, and if the knee pain is dramatically reduced, then we know that your nerves are in the right spot to do a bigger procedure, which we'll discuss in just a moment, called a Coolief. Now, by doing that with just local anesthesia, of course, you would only get pain relief for a very short time. The important part of that procedure is to come to us with a painful knee. So if you're getting ready for a knee replacement, you might have knee pain every day anyway, but it never hurts to be a little more active on it or do the things that you know are going to make it a little more sore to come in for that geniculate nerve test block. Now, interestingly, that geniculate nerve test block is covered by almost everybody's insurance. What's interesting about that is it's testing to see if you're a candidate to have a bigger procedure called a Coolief, or a cooled radiofrequency ablation block to those nerves, which is not covered in the outpatient setting by insurance. And we'll get back to that more a little bit later. But if we were to do that test block and you got pain relief, even though it'd be transient, 20 minutes to 2 hours, maybe a day, then you'd be a candidate for another procedure, where again we bring you back to the fluoroscopy suite and under local anesthesia, put a probe into each of those areas through just a puncture hole in the skin, and heat up that nerve just to the point that it would stop working. It stopped working for 6 months. It takes about a month to really densely stop working, so we would do that procedure about a month prior to having a knee replacement. And then remember, it lasts another 5 months. So during the time you would have the surgery, you would have less discomfort around the time of surgery, actually require a little less anesthesia, certainly less pain medication, and with less pain, you'd recover faster with faster recovery with physical therapy, faster time to be able to walk on it, and get back to the activities not only that you need to do, but that you want to do. Now that procedure, the cooled radiofrequency ablation for temporarily numbing just the pain fibers to the deep part of the knee or the capsule, is called a Coolief. So if we talk about doing a GNB to possible Coolief so that you could have much less discomfort around the time of surgery and during the recovery period, that's what we're talking about. Not everybody's a candidate because not everybody's nerves are where they're supposed to be, but most people are. The unfortunate thing is, again, the procedure done in the outpatient setting is not covered by insurance. It's kind of a cash deal. But for most people, it's not unaffordable. And if you're one of those people who has both of your knees with arthritis, and both of them would need to have a knee replacement in a near future, there's actually a discount for doing both at the same time, because we use a lot of the materials over for the second side during the same setting. So we'll discuss those costs with you and make the arrangements with you for those things if you have an interest.